Hello, I'm Professor Emily Mercuri, and this is Chapter 8, Administration by the Gastrointestinal Route in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to describe the advantages and disadvantages of administering medications orally, rectally, or by percutaneous endoscopic gastrostomy, also called PEG, or nasogastric tube, NGT. Explain the appropriate action to be taken when a patient is NPO, has dysphagia, refuses medication, vomits medication, or has allergies. List the special precautions to be followed in the preparation of sustained release capsules, enteric-coated tablets, and oral suspensions. Demonstrate the measurement of liquid medications using a medicine cup and syringe. Demonstrate proficiency in administering oral medications. Demonstrate proficiency in administering rectal medications. Discuss administration by percutaneous endoscopic gastrostomy, PEG, and nasogastric tube, NGT. Of course, for the 3 demonstrate objectives, we won't be actually demonstrating any of these. You wouldn't be administering oral medication or rectal medication without a license to do so. But for the measurement of liquid medications, if you do have a liquid medication at home, the ones that come to mind are like Dayquil, some kind of cold medication. I would love for you to look at the syringe, look at the medicine cup, and just familiarize yourself with those lines. Make sure that you understand how to read them, and that's going to kind of support the learning that you're doing in this chapter. So what do we need to know about gastrointestinal medication administration? Gastrointestinal is the most common route of medication administration. As we talked about in a previous lecture, it is usually the most cost-effective, as well as the most convenient for the consumer and especially for home use. Gastrointestinal medication administration has 4 categories: oral, rectal, percutaneous endoscopic gastrostomy or PEG, nasogastric tube, NG. So we will talk more about those later, but if you break down the meanings of those words, percutaneous means by the skin, endoscopic is the way that they perform the surgery, and gastrostomy is a surgical opening into the stomach. And so what a PEG tube is it's a opening through the abdominal wall directly into the stomach itself that medications and food can be delivered through. Oftentimes you see these on people who it's known they will need long-term access for feeding and medications, sometimes in small children if they've had very poor oral intake, especially if they were a micropreemie or they have any swallowing difficulty. This is a more permanent solution because it is a surgical opening into the stomach. And then a nasogastric tube, typically used more for short term. Naso, think nasal, nose, gastric, stomach. So it's a tube that goes in through the nasal cavity and down into the stomach, and that provides the ability to give medications, to give feedings, and also in an emergency setting, we sometimes use these to pull things out of the stomach, especially in cases of an overdose or someone who cannot protect their airway, and we may need to make sure the stomach is emptied so that nothing causes aspiration. All of the above mentioned routes do have advantages and disadvantages regarding medication administration, which we will go into in these next slides. Oral administration advantages. So the advantages of oral medication administration: it's convenient, it's comfortable for patients. As long as they do not have any difficulty swallowing, it's, you just take the pill and you drink some water and then you're good to go. It's safe for the most part. It's safer than a lot of these other routes, and it's cost effective due to less equipment utilization. So think about if you're giving an IV medication or even a IM into the muscle. You're going to need a syringe. You'll need some sort of needle to draw the medication up. You may need a needle to administer it if it's IM. So all of those supplies and the margin for error in choosing the wrong needle, those types of things, make oral administration more cost effective because you're not using all of that equipment. And then disadvantages: slower onset of absorption and action, right? It needs to go through the GI tract. Depending on the medication, depends on where it's going to be metabolized within the GI tract. That's going to take some time. Due to digestive fluids, some medications must be administered through injection. So, all that means is that not everything can be given orally because the stomach acid and the digestive fluids sometimes make it impossible for a medication to actually do its job if it's given orally. It's difficult, of course, to use in patients with nausea or vomiting. Oftentimes, in the case where we have severe nausea or vomiting and the patient can't keep it down, if there is a rectal route, we will use that route instead, but not all medications come in rectal form. It's dangerous to use in patients with difficulty swallowing, and it cannot be used in unconscious patients. PEG or NG administration advantages. Advantages of percutaneous endoscopic gastrostomy or nasogastric tube includes the ability to bypass the mouth and pharynx when necessary and eliminates multiple injections. If somebody cannot swallow a pill and there is a form that can be given in the PEG or NG tube, maybe they need 5 or 10 medications. Well, that's 5 or 10 injections we just saved them, either by shot or by IV. Because again, we don't want to place an IV if we don't absolutely need to. That's a more invasive route. PEG or NG administration disadvantages. So the disadvantages include discomfort in conscious patients and prolonged placement of tube in nose and throat. So these both are more pertinent for the nasogastric tube. That tube goes in your nose, down your esophagus, into your stomach, and the esophagus lies right next to the throat. And so people a lot of times say that they feel this dryness in their throat or this sensation of needing to clear their throat, a tickle, it's constantly uncomfortable. They sometimes will kind of try to cough a little bit to ease that discomfort, and that can even displace the tube where it can get coiled. So you can imagine that wouldn't be very comfortable if somebody was conscious and awake. And yes, we do have them in conscious and awake patients, especially post-surgery or if they have like a bowel obstruction. It's a very uncomfortable thing. And then that prolonged placement of the tube in nose and throat, it can lead to skin breakdown in the nair, which is the nostril. It can, it's a foreign object essentially being inserted into your body, and we don't want to leave that in for a long period of time, which is why if somebody needs this long term or especially for life, we're going to go typically with that PEG tube, which is a more permanent entry point into the stomach. Rectal administration advantages. Advantages of rectal medication administration route include bypassing the action of digestive enzymes, avoidance of irritation to the upper GI tract, and usefulness with dysphagia. So again, it's a great option if someone can't swallow. It bypasses the stomach acid and things that might cause altered metabolism. And then the upper GI tract, there's certain medications that can cause increased acid production or reflux or can irritate the gastrointestinal tract. Ibuprofen is one that comes to mind. We caution patients not to overdo it with the ibuprofen as it can cause stomach irritation. And so the rectal administration bypasses all of that. Disadvantages include unavailability of many medications in suppository form. So there's just a very limited amount of medications we can choose from in this form. Difficulty retaining suppositories. In order for a rectal medication to work, the suppository is placed in the rectum and the patient is instructed to kind of hold it in place. The body's natural reaction is to try to push that out because that is the way that the rectum and the GI tract work, is to move that direction out. And so trying to have them retain it inside, some people will have a hard time doing that. Rectal irritation, as the suppository starts to break down and do its work, it can cause irritation in that area. And then irregular or incomplete absorption due to the presence of feces. If somebody has a large fecal impaction, it can cause altered absorption. Guidelines for administration of oral medications. As a healthcare professional, it's important to understand proper administration of oral medication. From aseptic hand washing techniques, locating medications, reviewing physician orders, preparing doses, verifying and identifying the patient, dispensing the medication, to properly documenting in the patient's chart, these roles and responsibilities are critical to ensure patient safety. The figures below illustrate proper administration of oral medications. And so this person is opening the pill pack into the little paper cup, and then they are putting the pill into the patient's hand. If the patient's able, I actually like to hand them the cup so that they can do it from the cup so that it's never touching anyone's hands. But if the patient touches it and their hands are clean, it's going in their own body. So that's good. We don't want to be touching it with our own hands, however. Knowledge check. Which is an advantage of oral medication administration? A, slower onset of absorption. B, bypass action of digestive tract. C, patient comfort. D, avoid irritation to upper GI tract. The answer is C, patient comfort. Special considerations for NPO patients. Remember, NPO, nil per oris, nothing by mouth. Anytime there's a patient with NPO orders, it's important to check with the healthcare professional in charge regarding the appropriate procedure of medication administration, especially because this can vary from facility to facility. If a patient is fasting for tests, meaning they should not have anything to eat or drink before getting certain lab work or certain diagnostic procedures, the medications can usually be given at a later time with possible modifications or with clear liquids if the physician approves. Sometimes they will say NPO except for medication with the knowledge that the patient will need a little sip of water with the medication, but you want to always clarify before giving any medications. If a patient is NPO due to surgery, nausea, or dysphagia, just in case we haven't gone over it, it means difficulty or altered swallowing. It may be necessary to consult with the physician regarding a route administration change. It's imperative to not omit the medications completely without specific instructions. So it's not acceptable to say, I'm just not going to give these because they're having surgery, because those medications might be important for them to have prior to the surgery. Or, I'm not going to give these until, they have less nausea. We don't want to hold medications. A lot of medications are very time-based, so you need to be aware of that. If a patient refuses to take a medication or vomits within 20 to 30 minutes of taking the medication, report this to the health professional in charge. In addition, we have to document in the patient's record with the time and appearance of the emesis to check whether the medication remained intact. So if they threw up and there is a whole pill or fragments of the pill, we don't know if it actually was absorbed. It's also important to document the reason if someone refuses. So in general, I will say there's usually a reason for patient refusal. And so just saying the patient refused and not giving a reason is lazy. It's not good nursing or healthcare. So I like to say patient refused this medication because, let's say it's morphine. Patient concerned about addictive properties of morphine. Nurse educated patient about that morphine does not cause addiction if it's being used for the right reasons. Research supports using it for severe pain. Patient still declined. Can I request another non-narcotic medication? So something of that sort where it's not just a patient refused, it's a why and how can we solve that problem. Knowledge check. If a patient is NPO, some medications can be given with A, fruit juice, B, milk, C, clear liquid, D, cola. Answer is C, clear liquid. And just this brings up a point that even if they're not NPO, if we're giving medications, we should always be giving them for the most part with water. And some medications can actually be altered if you give them with milk or with juice because of the properties of those liquids. And then even cola, of course, you think of something fizzy, carbonated with a pill, that can alter the way that the pill is absorbed. So we always want to give all medications with clear liquid. Preparation precautions for liquid medications. The following are the guidelines and precautions for preparing liquid medications. Shake if indicated, remove cap and place upside down on the table. Meaning place the cap upside down on the table so that the inside of the cap is not touching anything contaminated. Hold the medication bottle with the label side upward to prevent spearing. At eye level, pour prescribed amount of medication. It's very important that you do this at eye level, because if you're looking above or below eye level, it's going to read differently. So if you're looking at it from above, it will look lower than it is. If you're looking at it from below, it will look higher than it is. So make sure you're holding it to eye level. Replace some medicine bottles in the cupboard or medicine cart, depending on if it's a one-time use or if it's a multi-use bottle, we'll replace it. Compare the information from the orders to the label on the stock bottle. Replace the cap on the bottle, recheck the 7 rights of medication administration, and proceed with the guidelines for administration of oral medications. Preparation precautions for sustained release and enteric-coated medications. The following are the guidelines and precautions for preparing liquid medications. Do not crush the content in a sustained release form or allow patients to chew it. I did mention this in a previous lecture, but sustained release is meant for these little capsules to dissolve in a time-sensitive fashion throughout the GI tract for proper absorption. So if you crush or chew the medication, it's not going to work properly. Little funny anecdote, I had a friend start a stimulant medication for ADHD, and she texted me and she said, I just feel so much energy. Like I just had 3 cups of coffee and I chewed the medication, and I had to stop her. I said, you did what? Because she had an extended release dose. And so I told her, just monitor yourself, drink lots of fluids, but definitely that was not the proper way to take that medication. And that's why she got this kind of intense rush of the action of the medication, because she didn't take it the proper way. So she took it again the right way the next day, and she said it did exactly what it was intended to do, and she felt a lot better. Review the package insert or seek assistance from the pharmacist if the patient is unable to swallow. So if you get a medication order and you know that the patient's unable to swallow, look through the insert, see if it's okay to give it in a crushed form into an NG tube if they have one. Or some patients, they can swallow like applesauce, but they can't swallow a big pill. So some medications are appropriate for you to crush and put in applesauce, but we need to make sure that we are following the directions. Double check medication to ensure specific foods are allowed. Like I said, some medications, they will actually, the effect will be crossed out if you use milk, or I know one in particular, it's grapefruit juice because of the level of acidity. For the most part, people aren't taking the medication with the juice to swallow it down, but they may be eating a meal at the same time, right? So you want to make sure if the insert of the package of the medication says, do not take with milk or do not have grapefruit juice, it shouldn't even be in the meal if they're taking their medications at mealtime. Wipe down any equipment that may be used to modify the medication for administration, and proceed with the guidelines for administration of oral medications. Back to this, wipe down any equipment that may be used to modify. It's just saying if you're adding anything to it, if you're mixing it, if you are using a syringe and then putting it into a cup, we're going to make sure we clean up our equipment. Knowledge check. Which is not a precaution when administering a liquid suspension medication? A. When removing the cap, place it facing up on the counter. B. Compare information from the bottle to the physician order. C. Recheck 7 rights to medication administration. D. Replace the cap on the bottle when finished. The answer is A. When removing the cap, place it facing up on the counter. The wording is a little tricky, but they want you to know face it upside down so that the inside of the cap is not being contaminated. Liquid medication measurement and administration. Proper steps are as follows. Pour the prescribed medication into the medicine cup, as always screening for the 7 rights of medication administration. Withdraw the prescribed amount with a syringe. Check the medication against the orders using the 7 rights of medication administration for the second time. Identify the patient and scan the wristband if you're using the electronic medical administration record or EMR, and or verify patient name and date of birth. This is a image below about how to properly measure. And so this person is looking at eye level at the medication, and you'll notice that she is leaving the little cup on the table and she's squatting down. If you lift the cup up, you run the risk that you're not holding it actually evenly or level. And so you could be reading from the wrong side. So you do want to get to the level of it, not bring it up to your eye level. And then this arrow is pointing to the middle of the meniscus of that little film, that little almost bubble looking thing that forms on the surface of water or of liquid due to liquid tension. And so you want to measure at the middle. That's going to be the most accurate spot for you to read the number. Continued steps of liquid medication measurement and administration. Identify the patient and scan the wristband if using the EMR and/or verify patient name and date of birth. Elevate the patient's head. Ideally, they will be at a high Fowler's position, meaning that they are sitting pretty much straight up in the bed. Ensure the patient is alert and able to swallow. Place the syringe tip in the pocket between the cheek and gums. Instill the medication slowly to lessen the chance of aspiration. Be sure the patient swallows all medication completely. Proceed with guidelines for the administration of oral medications and document appropriately. So all this is really saying is we're going to make sure that we are giving the medication with the patient sitting upright. We're identifying them. We're using our 7 rights of administration. We're checking 2 patient identifiers, name and date of birth. And the syringe goes in that little pocket between the cheek and gums. It will stimulate that kind of swallow reflex so that they're not, and it bypasses the tongue. They'll still have some taste, but they're not getting this predominance of the medication taste on their tongue when you do it in that pocket between the cheek and gums. Knowledge check. When removing the cap of a multi-use liquid medication bottle, the cap should be placed A, in a trash receptacle, B, right side up, C, in a cabinet, D, upside down. And the answer is D, upside down. They really want you to know this one. Knowledge check. Before administering an oral medication to a patient, the health professional should A, ask the patient the dose to be administered. B, administer the dose that was previously given. C, verify orders using the 7 rights of medication administration. D, administer the dose recommended on the internet. Of course, the answer here is C, verify the orders using the 7 rights of medication administration. Administering rectal medications. So there are times medications are ordered to be administered through the rectal route. This route is used for small children who cannot swallow medication, comatose patients, patients with severe nausea or vomiting, and those who cannot swallow pills. Rectal medication may be in suppository or liquid form and is administered as a retention enema. So if it's a liquid form, the liquid goes into the rectum, and that's where they actually really have to clench and try to keep that inside, which is a hard thing to ask, especially for a lot of our elderly. Retention enema must be retained for approximately 30 minutes or more for absorption. So just think about that. 30 minutes of being asked to kind of clench your rectum, that's not going to be comfortable. So just something to be aware of. The patient should be instructed to lie quietly on either side to aid in retention. Remember to treat the patient with dignity and always explain everything you're doing and why. You should be placing them also on some padding, like some absorbent pads. And so because if any of this kind of leaks out, or typically if you're using this type of medication, it's usually to try to stimulate a bowel movement, it's going to be a messy process. And so we're going to have them on absorbent pads, and we'll put a blanket over top of them so that they're not just laying there exposed. And this is called a Sims position, this picture here, where one leg is slightly over the other leg. That's the best position to administer a rectal medication. Instructions are as follows. Wash your hands. Compare the label against the medication and check the medication order using the 7 rights of administration. Identify the medication and research information if necessary. Assemble supplies, which would include disposable gloves and water-soluble lubricant. Check patient identification and verify the name and date of birth. Select medication as ordered and double-check the name and dosage again. Explain the procedure and answer any questions. Close the door and curtain completely for patient privacy. Lower the head of the bed and position the patient on the left side with the upper knee bent. Keep them covered, only exposing the rectal area. And the reason that we do it usually on the left side has to do with the descending colon and the sigmoid colon, just because those are on the left side of the body. And so it makes the most sense for that side to be down, to be facing down when they're lying laterally. Next steps, we will apply our disposable gloves, put on the disposable gloves and remove the suppository from the wrapper. Lubricate the tapered end with a water-soluble lubricant. With a non-dominant hand, you separate the patient's buttocks gently so you can see the anus. Ask the patient to take a deep breath, insert the lubricated suppository, and push gently with the gloved index finger until the suppository has passed the internal sphincter. Sphincter is something that we have control over for a normal person that doesn't have any altered, digestive or any kind of issues. That is how we can control, okay, I'm going to stop this poop from coming out, or even I'm going to stop this urine from coming out, is because that has a sphincter as well. And so that little sphincter, we have to push the suppository past that. Urge the patient to retain the suppository for at least 20 minutes. If they're unable, hold the buttocks together as required. And then again, if you're using a liquid, it's 30 minutes. Remove and dispose of gloves. Be sure the patient is comfortable with covers and bed adjusted appropriately. Wash your hands and document appropriately. Something to note too is there is this nerve that runs down through the body, the vagus nerve, and you can accidentally stimulate that, which can cause somebody to faint. It's unlikely, especially if you're administering medication exactly as these instructions say, you're not going super deep, but just something you want to be aware of as you're putting any kind of pressure inside the rectum. Knowledge check, which describes the positioning of the patient's leg when utilizing the rectal route for medication administration. A, both legs straight. B, both legs bent up to the chest. C, lower knee bent. D, upper knee bent. And the answer is D, upper knee bent. PEG and NG tube administration. PEG and NG tubes are not inserted for the sole purpose of medication administration. However, they may be a source of medication administration if it can be administered through the PEG or NGT, meaning we don't put these in just because we want to give medications, but we can use it if it's already in. Administration instructions include checking the medication order using the 7 rights of medication administration. Compare the label against the medication sheet. If the administration must be on an empty stomach and the patient is getting a feeding through that tube, we hold the medication. We stop the tube feeding for 30 to 60 minutes, depending on the medication being administered, and then we return at the appropriate time to administer the medication. If the patient is not receiving a tube feeding or the medication can be administered with the tube feeding, which is going to vary for each medication, continue with medication administration. Something to note too, sometimes these NG tubes are hooked up to suction. And so we also, if it's hooked up to suction, we need to stop the suction, give the medication, and hold the suction for anywhere from 30 to 60 minutes after. Otherwise, all we're doing is injecting something and then it's getting sucked right back out. We want to wash our hands and wear gloves when handling the nasogastric or PEG tube. Prepare the medication as ordered and be sure the medication is at room temperature prior to administration. Check the identification bracelet or verify name and date of birth with the patient. Elevate the head of bed if not contraindicated. For most patients, if they have an NG tube or a G tube, we are always going to elevate the head of the bed to at least 30 degrees because they are at high risk for aspirating. Hold the end of the tube and remove the clamp, plug, or adapter. Verify that the tube is properly placed in the stomach and verify that the tube is taped at the appropriate centimeter marking. When you put an NG tube in, you mark in the chart, it's at 50 centimeters, let's say, and there's measurement markings on the tube. So you want to make sure it hasn't moved from where it's supposed to be. Aspirate with a bulb or piston syringe for stomach contents and check the pH of the aspirated fluids. It's not something we really do anymore to check the pH. And oftentimes, as long as we have confirmation that the tube's in the right place via x-ray, if it's an NG tube, we can give medication and food through that. But if you are like having a G tube, we do typically pull out a little bit called residual, and just make sure that we're seeing how much is left in the stomach after a feeding or medication administration, because we want to make sure that they are absorbing at the proper rate. So let's say we gave them a feeding and we stopped it an hour ago and there's still a bunch of that in the stomach. They may be having some slowed absorption. And then we will go ahead and actually put that back into the stomach, that residual, because we don't want to rob them of those nutrients. Verify that the tube is, I already went over this one. If the aspiration does not meet the perimeters, so if you're not seeing any kind of aspirate, which you should see some, or if there are any questions, do not instill any liquids and report to the healthcare professional in charge. Clamp the tube with your fingers by bending it over itself or pinching it. After the tube is closed, remove the plunger or bulb from the syringe, leaving the syringe attached firmly to the tubing. So oftentimes we will leave the syringe. There's different methods, but in this method, you attach the syringe into the little port in the tubing, and then you flush it with water, make sure the water goes in. You pour the medication into the syringe. If it's a powdered medication, you have to mix it with a little bit of water because you need a liquid. You're going to pour the medication in, release the unclamped tubing, and let the medication flow through by gravity. So this is called the gravity administration. Never force fluids down the NG tube. I will say sometimes you're gently actually pushing with the piston of the syringe. Depends on the medication, depends on the patient. And I'm going to go ahead and link some videos in the Canvas course so that you can see this if you're interested, because if you've never seen it before, me talking through the steps might be a little bit confusing. Always watch patients during any procedure. Stop immediately if any signs of discomfort, coughing, or shortness of breath occurs by pinching the tube. The syringe should be at the level of the patient's shoulder to eliminate the risk of the fluid running too quickly. If they start coughing or acting like they can't breathe, we want to make sure that we're not accidentally feeding the lung, is what we call it. Again, if you did your checks, this shouldn't be an issue. But if the tube migrates at all and liquid is going into the lung, that's a medical emergency. Before the syringe empties completely, we flush the tube by adding 60 to 100 mLs of water to the syringe, or the amount ordered. A lot of times it's more like 20, where we don't want to give them an excessive amount of water, especially if their medications were all mixed with water. We don't want to be giving them large volumes at one time. If the patient's input and output are being monitored, be sure to add this amount to the patient's record. After the water's been placed, pinch the tube, remove the syringe, and clamp or plug the tube. If the patient's on suction, as I mentioned before, be sure to leave the suction turned off for at least 30 minutes until the medication's absorbed, and then restart as ordered. If the patient's receiving a tube feeding, be sure to leave the tube feeding turned off for 30 to 60 minutes, depending on the medication, and until the medication is absorbed, and then restart the tube feeding. Position the patient on the right side and/or elevate the head of the bed to encourage the stomach to remain empty. Ensure the patient's comfortable. Proceed with the guidelines for the administration of oral medications for documentation. Knowledge check. Patients with a PEG or NG tube should stop feeding blank minutes before receiving medication through the tube. A, 30 to 60, B, 10 to 20, C, 20 to 40, D, 60 to 120. And the answer is A, 30 to 60. Self-assessment. What are the advantages of administering medications orally? What precautions must be followed when administering sustained release medications? List the appropriate actions to take when a patient refuses their medications. Again, use this self-assessment to kind of tick through your brain. Do I have the answers to these? What do I need to focus on more? Where are my areas of growth? What am I understanding? What do I need further clarification on? And as always, reach out if you need anything. This has been Chapter 8 of Essentials of Pharmacology for Health Professions, 9th edition. Thanks.